Sleep apnea in elderly adults. Introduction. As soon as a person falls asleep, he or she goes into deep sleep. Select true or false. Correct. A person has to go through drowsiness and light sleep before reaching the deep sleep stages. As people get older, they spend less time in deep sleep. Select true or false. Correct. This may be why older people are often light sleepers. All people with sleep apnea are aware when their breathing is interrupted and they are awakened to resume breathing. Select true or false. Correct. People with sleep apnea may not be aware that their sleep was interrupted. It is usually another person sleeping in the same room that notices the sudden snort and complains about it. Which of the following medical conditions could be caused by sleep apnea? Choose one of the following options. 1. High blood pressure. 2. Heart attack. 3. Stroke. 4. All of the above. Correct. Sleep apnea can cause many serious health problems. Sleep apnea is a serious medical condition that could cause death. Select true or false. Correct. Sleep apnea leads to medical conditions that could be fatal. Also, sleep apnea can cause falls that may be dangerous to older people. Snoring is the best indication of sleep apnea. Select true or false. Correct. Not all people who snore have sleep apnea. The best indication of sleep apnea is if breathing stops during sleep. People over 60 are more likely to have sleep apnea because the muscles and tissues around their throat have lost their firmness. Select true or false. Correct. The throat is more likely to collapse when sleeping since the muscles are no longer firm. Which of the following is the most common treatment for moderate sleep apnea? Choose one of the following options. 1. CPAP. 2. Mouthpiece. 3. Surgery. Correct. CPAP is the most common way of treating sleep apnea. Thank you for using Explain.